Hi friends, let's talk about a very common and a very popular question that my patients ask me all the time. What is the best treatment for a 80 to 90% heart blockage? So my friends, the first question is to assess what is the severity of the symptoms that you are having. Are you having severe chest pain? Are you having it daily? Are you having it once in 2 days? Or are you having pain maybe once a month or twice a month? So the frequency and severity of your symptoms tells us what is the urgency that we need to do something about it. Now, if your symptoms are very frequent or very severe, then we go directly to stenting procedure or surgery for fixing the 80 to 90% blockage. The other question we have to ask is, where is the blockage located? The heart has three main blood vessels. The left main artery divides into two blood vessels called the LAD or the widowmaker artery and the circumflex artery. And on the right side, the heart has an artery called RCA. Now, the question is, where is the 80 to 90% blockage? If the 80 to 90% blockage is in the left main artery or the proximal segment of the LAD, then we know that a major part of the myocardium or the muscle of your heart is at risk. So in this case also, we do not wait for a long time and we either recommend stent or surgery to open up these blockages. Now let's talk about another situation, that the 80 to 90% blockage is either in the RCA or the circumflex, or it is in the distal part of the LAD. In this situation, we can safely treat you just with medications initially. So we start you on aspirin, statin, as well as medications like metoprolol, carvedilol, amlodipine, ranolazine, and medications like this help to improve the blood flow to your heart despite a 80 to 90% blockage. Now, many patients may have significant improvement in their symptoms or complete resolution of their symptoms just with medications. So, if the blockage is not in the left main or the proximal LAD, you can be safely treated with medications. But if the medications either give you only partial relief or the medications are not helping at all, then in that case we have to still go and put a stent to relieve the blockage and to relieve your symptoms. There's another caveat to that. Sometimes the 80 to 90% blockage is in a small branch of one of these three arteries that I just mentioned. Now we have to see what is the size of that branch, because our stents are smallest size stent is about 2 millimeters. Now, if the branch is smaller than that, then even though there might be a 80 to 90% blockage, we may not be able to technically open it up with a stent. In that case, we are again limited to medical therapy. But the good news is that if it is a small branch, then even if it were to become completely occluded in the future, it's not going to damage a big part of your heart muscle. So it's less likely to cause a major heart attack. So that is the good part about it. So let's summarize. If you have a 80 to 90% blockage, which is a severe blockage, in that case, we have to decide the urgency of the intervention based on your symptoms. The other question is, where is the blockage located? Because if it is in the left main or proximal LAD, we need to do something about it urgently with intervention like stent or surgery. But if your 90% blockage is either in the RCA, circumflex, or distal LAD, then we can treat it with medications very safely. And as long as your symptoms are better and resolved, then we don't have to do any stenting procedure. So my friends, hopefully this discussion was able to give you some insight into the treatment of a 80 to 90% blockage. And if you have any other questions related to this topic or any other topic in cardiology, please feel free to comment. And don't forget to like and subscribe our channel. Thank you.